we don't need to place stem cells in every single spot to get a result, because the cells are living organisms and they migrate to the areas that need the repair. And that's why we use the laser stimulation on the superficial areas of the skin to draw those stem cells upwards into the skin, and they'll spread through the area really quite nicely. First injection we're going to go in through here. Did you feel that at all?
No.
Okay, now we're in a very, very superficial layer and just going to lay down a little bit of stem cells just through there. And you can see how I'm fanning out this whole area. So as you can see, these are the key areas that we would normally look to inject. Everybody has concerns about these little crow's feet lines. This is the area we call the nasolabial fold, and you can see that we're just placing very, very small quantities of this lovely stem cell mixture throughout the key areas of the face. Now, one of the other advantages to this particular style of stem cell facelift and this injecting technique is that we don't get a lot of bleeding, and so the patients don't look frightful when they leave. Certainly there's a bit of bruising, and that can occur anytime there's an injection into the face, and that'll occur with any technique. But one of the advantages of this technique is the very few injection portals that require that allow us to cover the whole area that we're looking for. So our selection of technique and our selection of injection points depends entirely on what we're looking to treat for the patient. So this element of it is all done now, Kate Marie. And what we're going to do in a minute is to get you off to have your laser done. And
what sort of laser is it?
It's what we call a non-ablative laser. We'll be using the Laser Genesis, which is a type of laser that's designed to improve texture and quality of complexion. So the treatment with the laser is often used on its own for those purposes. When we use it in conjunction with the stem cell facelift, we actually get really quite a remarkable result, because the combination of the laser collagen stimulation and the effect that that has in turn on the stem cells is really quite extraordinary. You shower normally, you wash normally, you can massage if you feel any little bits of swelling at all.
Okay.
That's really not an issue. You can put makeup on, that's no problem either. So there's very, very little post-operative care that's required at this point. What you might feel over the next few hours or even few days is a very, very light, tingly type sensation in your skin. That's actually a good thing if you feel that. Not everybody gets that, but if you do, it's nothing to be worried about. It's actually a very good sign. Now the next step, as I mentioned before, is we're going to use our laser, our 1064 laser, to stimulate the collagen production, and really it's like putting the icing on the cake for this particular issue. So it works well, and there's no downtime from the laser either, so it's not a burning laser. It's a laser that'll leave you a little bit flushed and blushed for 3 or 4 hours. But apart from that, nothing at all. You can still use your makeup normally and go about your normal activities without any problems.